Fiona. Good morning, everyone, and thank you for coming here today. Yesterday we announced new public health rules would kick in from 6 p.m. last night. Thank you to everyone in the community for listening to the health advice and following the directions. On my way home yesterday afternoon, I noticed people were already doing the right thing and putting their masks on. Yet again, the response from Western Australians has been world class. I acknowledge many Western Australians would prefer to not be wearing masks in indoor public venues across the festive season, especially when it's so hot, me included. But the direction is based on health advice is to keep us safe from any potential risk. And therefore, it is necessary, at least until we know more about any potential spread. I want to nod to the many West Australians who have clearly done the right thing and put their masks on where required. It's really encouraging to see so many of you masking up to protect each other until we know more. Thank you very much. I'd like to acknowledge the workers who are spending their Christmas Eve staffing testing clinics across our city in very hot conditions. To these workers, I say thank you. For those of you who will face queues at testing clinics, please be prepared, please be patient. Our staff are doing the best they can in difficult circumstances. I also want to thank everyone working across vaccination clinics, helping with traffic management around the clinics, and those getting on with the job on the front line yesterday, today, and in the coming days over Christmas. I've just come from an emergency management team meeting which was held to discuss the potential risks associated with the 25-year-old man who tested positive yesterday. The advice we have received from the Australian Border Force is that the French backpacker arrived in Australia before the onset of the pandemic on January 7, 2020, and has remained in Australia for the last 2 years, or thereabouts. Fast forward to this month, he entered WA on December 12. At the time, Queensland was set as a very low-risk jurisdiction, as they had virtually no COVID in that state, which meant people entering WA from Queensland were not required to be vaccinated at that point in time. However, that changed the next day. And now, under our Safe Transition Plan, from February 5, everyone who is eligible, aged 12 and over, is required to be double-dose vaccinated to enter Western Australia. Obviously, Western Australians are preparing for Christmas celebrations, and we want to be able to bring you as much information as we can. So, I can announce that Western Australia has 4 new local COVID-19 cases as of 9 a.m. this morning. Yesterday, 10,267 tests were taken through public and private clinics across Perth. This is an incredible number, especially given testing didn't ramp up until the afternoon, and especially given the extreme summer weather conditions. It's important people who are lining up are prepared to wait and prepared for very hot conditions. So please bring water and sun protection. Clinics were scaled up yesterday and stayed open until 10 p.m. last night. They will keep operating throughout Christmas and Boxing Day. The Health Minister will provide details shortly. I will outline what we know about these cases. The 4 cases. One is a close contact of case 1133, who also attended the Mess Hall event on Sunday, December 19. The other 3 are casual contacts of case 1133, who also attended the Mess Hall event but were not known to case 1133. As a result of the high-risk nature of the Mess Hall event in Northbridge, our health authorities will now upgrade the contact status for the Mess Hall event. This means that anyone who attended the event must get tested and now self-quarantine for 14 days from the date of exposure. As the date of exposure is the 19th of December, this means they will be in quarantine until January the 3rd. We are making urgent arrangements to ensure everyone who was at the Mess Hall event, around 400 people, are tested and quarantined appropriately. Now there are 21 close contacts linked to 1133, 9 of whom have tested negative so far, and the 1 positive I mentioned earlier. There are also 991 casual contacts, of which 336 have tested negative so far and 3 positive, as I detailed before. We expect the number of contacts to continue to increase. Last night, Health reported the partner of case 1133 and his 4 housemates have tested negative. They were all vaccinated. As a result of the Mess Hall event and the large number of patrons who attended that event, our authorities have quickly responded to limit the spread as much as possible. A high number of patrons have been staying at the Fremantle Old Fire Station Hostel. This morning, WA Police locked down that hostel. As this accommodation is not suitable for people to self-quarantine in, everyone staying in that hostel will now be provided with more suitable accommodation to complete their quarantine period. Overnight, Health has identified new exposure sites across Perth, and these are published on wa.gov.au. These include Montclair Boutique Apartments in East Perth on December 22 and 23, that is yesterday. The Square Mirrabooka on December 22. New Park Shopping Centre in Girraween on December 18. Vans Shoe Store in the CBD on December 17. Kmart in the Perth CBD on December 17. JB Hi-Fi at the NX Perth Shopping Centre on December 17. McDonald's on Hay Street in the Perth CBD on December 17. H&M in Forest Place on December 17. And the Woolworths St George at the NX Perth Shopping Centre on December 17. A comprehensive list can be found on the wa.gov.au website with all the specific exposure dates and times and quarantine requirements. Please familiarise yourself with these sites, which are updated as our contact tracers keep working and interviewing people to get the latest information. As I said yesterday, I know public health rules are not the news we wanted to hear just before Christmas, but they are necessary to keep us safe and minimise any potential community spread of the virus, which would have far worse consequences. Now, with the detection of these new cases and the big number of tests are underway, more positive cases are expected, especially as we're still in the infectious period from the exposure date. Therefore, from 6 p.m. tonight, we will introduce an additional public health rule. For all licensed hospitality venues, seated service only will be permitted. This is on top of our public health rules we introduced yesterday, including mask wearing, the dancing ban except at weddings, and the closure of high-risk entertainment venues and large-scale events. The additional seated service only requirement is also in place until Tuesday morning, December 28, which will help us further limit any potential spread of COVID in the community. As I've said before, we want to keep Christmas as normal as possible for Western Australians. The seated service only rule for the next 4 nights allows for family Christmas lunches and dinners to continue safely as planned. But of course, this rule will mean larger venues, particularly pubs and bars. It will impact their normal trade, as everyone will be required to be seated to drink or eat. As a result of these local cases, we're in a holding pattern. As a result of these local cases, we are in a holding pattern while we get more tests done and develop a better understanding of the level of community transmission from case 1133. As detailed in our Safe Transition Plan, we'll be introducing a proof of vaccination requirement for a range of venues and events by February 5 or earlier, depending on how this outbreak plays out. This will further protect everyone who has done the right thing and gotten themselves vaccinated. These latest developments are a timely reminder of why it is so important to get vaccinated. Our vaccination rate is 91.3% for first dose 12 plus and 83.2% for second dose 12 plus. It's 59.9% first dose for Aboriginal people and 44.7% double dose for Aboriginal people across WA over 12. The vaccine commander told this morning's emergency management team meeting that we've seen an increase in vaccinations since yesterday's developments. Today, the federal government body, ATAGI, has announced changes to increase eligibility for people to get their third doses. From January 4, the interval between the second and third dose will be reduced from 5 months to 4 months. That interval will be reduced further on January 31 to 3 months. The Western Australian Government welcomes this announcement, which I called for at Wednesday's National Cabinet meeting. This means around 630,000 West Australians will be eligible for their third dose come January 4. For parents of children aged 5 to 11 years old, as of this morning, you can now book your kids in for their first dose at a state-run clinic from today for January 10 and beyond. This is obviously great news, which will be welcomed by many families across our state. The Health Minister will walk through these details shortly. I'd encourage all parents to get their children vaccinated from January 10 on, as they would with all other childhood immunisations. This is about protecting them, your families and the community. To further protect our community and in light of skyrocketing infections over East, we'll be upgrading our border arrangements. South Australia has today recorded an alarming spike in cases, 688 new infections. There are also worrying signs out of Queensland, which has recorded 589 new infections. This is of major concern. That is why both South Australia and Queensland will be reclassified from medium risk jurisdictions to high risk jurisdictions. The new border arrangements come into effect from midnight tonight. This will mean arrivals must be approved, fully vaccinated, comply with the testing requirements before and after arriving, use the G2G Now app and undertake 14 days self-quarantine with the G2G Now app. In closing, I want to wish every Western Australian a happy and safe Christmas. For those of you lining up for testing or vaccinations, please know you are doing the right thing for yourselves and your fellow West Australians. For those working at our testing clinics and indeed in our hospitals, police stations and other important workplaces, thank you for what you are doing to keep Western Australians safe. I'll take questions shortly, but first I'll hand over to the Health Minister, who will say a few words.
Thanks, Premier. I'd like to start by thanking the hundreds of Western Australians who got tested yesterday. More than 10,000 tests were carried out, and I understand that this is the last thing that you wanted to do just before Christmas, and I feel for those of you who will no longer be able to spend Christmas with your families. It generally takes between 24 and 48 hours for someone to get their COVID-19 test results, but rest assured our teams are working as fast as they can to get results back to people. Some are getting results back much faster than usual. Today we have 85 contact tracers working hard to identify contacts of the confirmed cases. Tomorrow, 56 contact tracers will give up the chance to spend time with their families on Christmas Day to continue this important work with the capacity to scale up if needed, and we thank them for this. I know that this is a tough situation, but by doing the right thing and coming forward for testing, you are playing your part to help reduce the spread of the virus and protect those in our community who are most vulnerable. Capacity at our testing clinics was expanded yesterday. State-run testing clinics opened at 7 a.m. this morning and will be open until 8 p.m. tonight. Tomorrow, Christmas Day, they will also be open from 7 a.m. to 8 p.m. On Boxing Day, they will open from 7 a.m. to 10 p.m. Private clinics are also open and are keeping similar hours. Please visit Healthy WA website to find details of your clinics. We have many clinics, and as you know, our clinics have been busy and some are busier than others. I would urge you to shop around. It might be worth travelling a little bit further to get tested and wait less long, and your wait might be reduced. With the hot weather, I'd also encourage you to plan ahead and bring a hat or umbrella, sunscreen and water. Encouragingly, we had a 38% increase in check-ins via the Safe WA app yesterday from the day before, so it's great to see that people are doing the right thing. Also today, we're announcing that children aged 5 to 11 years old will have access to COVID-19 vaccinations from January 10. Vaccines will be available at a range of GP clinics, pharmacies and state-run vaccination clinics across Western Australia. Bookings opened for state-run vaccination clinics today, and bookings can be made via Vaccinate WA. I'd encourage parents to make an appointment for your children. Bookings opened at 9 a.m. and in just 1 hour, the first 4 days' worth of appointments at Claremont Clinic were booked out. Across regional WA, Paediatric vaccine will be administered in WA Country Health Services. Bookings are also open at some participating GP clinics, and parents are encouraged to call their GP clinic directly to make an appointment. ATAGI has recommended a smaller dose of the Pfizer COVID-19 vaccine for children aged 5 to 11. The paediatric Pfizer vaccine will be administered in 2 doses, with the recommended interval between first and second dose being 8 weeks. The federal government allocation of the paediatric vaccine has been split 60-40 between GPs and state clinics, with state clinics expecting 33 doses to be available within the first week and 33,000 doses to be available within the first week, and state-run clinics will continue to receive 33,000 doses weekly in the coming weeks. I'd urge parents to book their children in as soon as possible. Getting vaccinated is the best protection we have against this virus. I'll hand back to the Premier now. I'll hand back to the Police Commissioner now.
Good morning, all. I'll make a couple of comments first, and then happy to hand back to the Premier for questions. The Supreme Court just a few minutes ago made a decision in terms of an injunction by one police officer. I'll make a couple of comments about this. One, the decision of the Supreme Court is an interim decision, and it only applies to a single police officer, not any other officers. The matter will be now directed to further directions on the 12th of January and likely to be then conducted with a view to a trial. It does not affect the Chief Health Officer's order. So that means that none of these police officers, this particular applicant, will not be able to attend a police facility in the interim period. I won't make any other further comments on that because obviously the matter is now before the court and the next date is the 12th of January. In regard to a very serious matter that occurred last night at a licensed premises on Grand Boulevard in Joondalup last evening around 10 p.m, 2 men were drinking at a table there. What police are alleging is that a 30-year-old man from Clarkson has caused grievous bodily harm to a 59-year-old man who is in critical condition in hospital. The 30-year-old man will be appearing in the Joondalup court this morning. Police are wanting any witnesses or any information that people may have to come forward to police on 131 444 or attend the Joondalup Police Station or indeed call Crime Stoppers if you have any information about that serious matter. A number of comments about the vaccine clinics and the testing clinics. We've had queues at both vaccine clinics and testing clinics, and you can expect that to occur today. I must reinforce, though, that the testing clinics and the vaccine clinics are 2 separate premises. So don't be confused between attending at a vaccine clinic. The testing is not available there. They are quite specifically different premises. They may be co-located on a hospital campus, for instance, but check the Healthy WA website or the wa.gov website and you'll see that the opening times and the locations of both testing and vaccination clinics are on those websites. The testing clinics will continue through Christmas Day tomorrow, as the Minister for Health has already said. The vaccine clinics will not be open tomorrow, but they'll resume on Boxing Day onwards. And again, I would ask people to check those sites. It is encouraging that people are both presenting for testing and for vaccines. It's a real pity that it is a consequence, I believe, of the outbreak that is now occurring in Perth. But nevertheless, please get tested and please get vaccinated for you and your loved ones' protection. Thank you. I'll hand back to the Premier.
Thanks, Minister and Commissioner. Any questions for me?
Premier, the additional 4 people, are we talking Delta or
The advice we have is sorry, I'll let you finish.
Sorry, is this Delta or
We expect that it's Delta because at the point in time he arrived from Queensland, that was the dominant strain there. So that's our expectation. There's still some analysis, genomic sequencing going on, which means we might get an outcome on that or answer on that today or tomorrow. Since I've been finished speaking and come back to the microphone, there's been another case identified, so it's now 5 cases. This is another person from the Perth Mess Hall event on the 19th of December. I don't have any further details than that, but there has been another person identified.
What are you reading to the spread of that? Have the health authorities given a gauge on what the spread means in terms of how infectious this person has been?
Well, it was an event with 400 people at the Perth Mess Hall, so that's the old Swan Barracks, just so people understand. So it has parties in the undercover area there, so there was 400 people there, including 100 from a backpacker hostel in Fremantle who went there at the same time. So it was very much a I suppose you'd say a young person's party in an enclosed environment. So at this point in time we have 5 people having acquired COVID from that single event. So they're obviously in proximity, they're probably dancing, having fun. He didn't know he was positive, we didn't know he's positive, so that's how this has come about.
And those positive contacts, were they staying in the Fremantle Hostel, do you know?
Some of them were, which is why we have locked that down. So that has now been locked down because some of them were there, and we know that 100 people from that hostel, which is the old fire station, went there together. So it's been locked down. We've made sure, and we are making sure, that they are put into more suitable accommodation for the next 14 days so that we can hopefully limit any further spread out of that venue.
But if there's further spread, then lockdown could be a possibility.
No, that's not part of our plans. I've said that repeatedly.
Do we know if any of those 5 people, were they vaccinated?
Of the 5, I think I outlined just a couple of quick things. Of the very close contacts of the backpacker, the 4 very close contacts, or 5 very close contacts, the girlfriend plus the 4 campers, we understand all of them were vaccinated and none of them are positive. Of the 5 positive cases, we know that 2 were vaccinated. So 2 we know weren't, 1 we don't know the status of at this point in time.
I mean, we've had people claiming to be friends with the backpacker saying that he was vaccinated. Is it true that he wasn't vaccinated?
The advice I have is he wasn't vaccinated.
And that, just to clarify again, so there's obviously the extra one that you've just announced, the 3 that were unknown to the backpacker, and the other one was known to him, and was he also, or were they also at the mess hall?
Yes.
Yeah. Okay.
Premier, sorry, I just on back. Can I just clarify? Of the new cases today, 5. How many, did you say were not vaccinated, or 5?
Well, I know that the advice I have is that 2 are vaccinated, 2 are unvaccinated, 1 we don't know.
And how many of those 5 were close?
1 was close.
When was those close contact like?
Known to him, a friend of his, yeah.
So the mess hall is obviously an enclosed area. There was also the Geisha Bar and Connections. Do you have any figures on the breakdown of testing from those?
No, I don't.
there?
Well, we haven't had any positives at this point in time come out of those venues. So that's why the mess hall event concerns us the most. That's why we have made that everyone who attended that event are close contacts. That's 400 people. They're required to quarantine for 14 days from the 19th of December. So from this point forward, I think it's 9 days.
And where are you providing that accommodation?
I'm sorry?
Where are you providing that accommodation?
Oh, we're working through, it'll be hotel rooms that are able to, so they're able to be separated. The exact details we're working through, but at this point in time, the Fremantle Hostel is locked down, so we have all the people, as best we can, who are at the Fremantle Hostel and also at the Mess Hall event. We've got them in sort of control, if you like. The reason we've done that is these hostels, as you know, will often have 6 or 8 people in a room, so it's very difficult for them to isolate. So that's why we've taken a particular interest in that hostel.
Premier, we've had a couple of cases in the last couple of years where people working at quarantine hotels, had acquired the COVID, but we've had situations whereby there had been no spread, you know, from those incidences. This seems to be different. I mean, with the cases what you've said today is in fact people that are vaccinated, at least 2 of them have caught the COVID virus. So what are we seem to be dealing with a whole new, I know you haven't said it's Omicron, but we seem to be dealing with something really different here.
Well, a few things about that. Firstly, it's the Delta. If it is the Delta variant, it's still highly infectious. So most of our outbreaks, bar one, were the predecessor variants prior to Delta. So Delta, of course, was regarded, certainly by people in New South Wales, as highly infectious. So that's point one. So even, it may be Omicron, but we suspect it's Delta. But notwithstanding that, it's highly infectious. Secondly, vaccination makes you less sick and reduces your transmissibility. It doesn't eliminate. So, and you know, we have to explain this constantly to people. A vaccination, a bit like a flu vaccination, it reduces your chance of getting the virus and it reduces your transmissibility. It doesn't eliminate. So if you're in a party, in a room with hundreds of people dancing in close proximity, you know, the chances are you're going to spread it. And that appears to be what's happened at the Perth Mess Hall.
So in regards to, if you could clarify comments you made yesterday, we're geared up at the moment to fully open our borders on February 5. We now have 5 cases. Can you just clarify for me again, do you still intend to open those borders on February 5?
Well, as I said yesterday, it all depends what happens now. We've actually toughened the borders today with South Australia and Queensland, so we can hopefully eliminate the risk of it coming in, any further cases coming in from there, and over coming days we'll determine whether or not we have any further community spread of the virus. The chances are we will. So we'll see what happens there and whether or not mask wearing and restrictions on venues and all the things we're doing eliminates the spread of the virus so that we can safely proceed to open borders on February 5. But if we have community spread of the virus over coming weeks, then it may well be that that 5 February date changes. It may well be it comes forward because if we have major community spread of the virus across the community, it may well be that February 5 becomes redundant. Now, I said this prior to the outbreak. I said I hope we make it to February 5. The plan was to make it to February 5 without community spread of the virus. This fellow came in from Queensland, whilst Queensland was at very, very low risk or very low risk. So in other words, there was thousands of people coming in out of Queensland because they didn't have community spread of the virus in Queensland. And our borders, again I'll explain it, our borders were based upon states and what the risk profile of each state was. And Queensland, at the point in time this person came in, was at very low risk. So people were travelling freely between Queensland and Western Australia without restriction. So that's how he came in. Unfortunately, he was one of basically half a dozen people in Queensland who had COVID at that point in time. And he came to Western Australia. It was a very, very unlucky event, and he came in basically 1 hour before we put up a hard border with Queensland.
But why would you want to come forward? If you're talking about February 5 as the opening date, and we're now starting to get cases. Yeah. Sorry, I don't understand your thinking there. Why wouldn't you sort of say, okay, well, you know, we're not going to reopen the borders? Why are you saying, well, we've got cases, we're just going to open it up early?
I'm not saying that, Joe. I'm said we're going to reconsider. If we have community spread of the virus, we'll have to reconsider what we do.
What level of cases or what number of cases would you see the hard border being redundant?
Well, we'll consider all these matters. I mean, you know, if you have community spread of the virus here, which hopefully we don't, and that's what we're trying to prevent with the measures we're putting in place. Bear in mind the measures we're putting in place here for 5 cases, as tough as the measures in New South Wales with 5,000 cases per day. But if I can finish, we are in a bit of a twilight zone here. We don't know how much spread is out there, so we're trying to work out what it is. And on the 27th of this month, we'll be able to get further information and work out whether we need to continue the restrictions, whether we need to toughen them, or whether we need to loosen them. And that will provide us with further direction. But as you know, over the course of the last 2 years, You know, things move rapidly and quickly, and you've got to respond to the circumstances you face. So I'm just hopeful that this doesn't result in further community spread, and we can proceed safely as we can, to February 5 with very high levels of vaccination before we bring down borders. But I also make the point, our vaccination clinics have ramped up. More people are getting vaccinated. People are booking their kids in. I expect a lot of the anti-vaxxers are now going getting vaccinated. I expect a lot of people are going and getting their third doses. And that's a good thing out of this. Go and get vaccinated. And if we get to very high levels of vaccination as a result of this, well then that will be something that improves the situation for all of us.
If you do have community spread, why would you open earlier than February 5 and put additional pressure on the health system?
I didn't say that. I said we will have to reconsider what we do. If we end up in the situation that South Australia or Queensland are in, well then we'll have to reconsider. Bear in mind our rules around people travelling into Western Australia were based upon us getting to over 90% double dose as a safety precaution, and they also have people coming in from other states who are required to be PCR tested before they arrive, double dose vaccinated as well.
In
But
announcing
what does reconsider?
Yeah,
You did
I can't answer it any better than I've answered it for you, Joe.
Okay, but just to clarify, so our reporting is accurate, you did say that you could bring the border earlier. I heard you say that.
Yeah, it might be.
So what does that actually mean?
Well, what it means, okay, so if we end up in the position, which I hope we don't, like Victoria, imagine if we end up in that position, which I hope we don't, and we're trying everything we can to try and avoid that occurring. Well then obviously we need to reconsider what we do in the lead up to February 5.
in announcing the Queensland border upgrade on December 11, I think it was, in the media statement it said if you had been at an exposure site in Queensland from December 1 to December 12 or 13, I think it was, then you have to quarantine, get tested, all that kind of stuff. Are we thinking that this backpacker did visit an exposure site because he's got the virus somehow?
We've asked the question and we've put the exposure sites to him, and he's indicated he didn't go to any of the exposure sites.
In regards to church services tomorrow, will there be services over 500 people, or have they been told not to go ahead?
No, the rule is that people are required to wear masks in indoor settings, and I expect that all church services people will abide by that rule.
But if there's a similar level to, say, a festival, church services are exempt? So a festival,
No.
1,000 people go, church service, 1,000 people go?
No, we've cancelled the big music concerts, we've closed nightclubs, but what we're saying for indoor venues, that you're required to wear masks for those events that are, seated hospitality events, they're required to be seated.
You're acting under the advice that yesterday's case, the man who travelled from Queensland wasn't, we believe, infectious for those first few days in WA. The people who were exposed at the Perth Mess Hall, do you believe they were infectious from that night, or do they also potentially have a non-infectious period?
Well, COVID's a funny thing. I think infections, I'm not a doctor, but your infectious period starts some days after you acquire the virus. But they have been, and it actually starts before such time as you become symptomatic, about a day before you become symptomatic. So, but we have picked up 5 people at this point in time. We don't know how many more are out there, how many more are infectious, how many more have been going to events or functions. That's why we're being so precautionary about what has occurred.
And how many of those 5 people are showing symptoms or feeling sick?
I'm sorry?
The 5 positive cases.
I don't know the answer to that.
Yeah.
In October or November, the health department uploaded a list of FAQs that said that by November 15, I think it was, then all jurisdictions would be classed as the borders would require any traveller from any jurisdiction to be double vaccinated. At the time, you said it was an administrative error. Obviously, health was looking at it. Do you regret not bringing that policy in?
We didn't bring it in based upon the legal and health advice we received at that point in time. And the advice basically said that if someone challenged that at that point in time from a very low risk jurisdiction, that challenge would likely be successful. So that's the reason we didn't bring it in on that day. So That's what occurred. But you've got to bear in mind, Queensland, at the point in time we announced the hard border, on that day had one community case. One community case on that day. The day before they had 6 community cases, but in other words, out of a state of 5 million people, at that point in time, they'd had 7 cases. So we still took a very precautionary approach, and we put in place the hard border that night. Unfortunately, this person came in 1 hour before the hard border was put up.
Can I just on the back of what the Health Minister said, testing results normally 24 to 48 hours, yeah? I think, Minister, you might have said that some people are getting theirs, earlier. Is there any moves to try and get, because a lot of people will be waiting for the results and we'll have to quarantine for Christmas, which I know is a small price to pay, but, well, as long as you don't have to do it, I suppose. But is there any moves afoot to try and get that testing, those results earlier? Is there a way of doing that?
I think you've got to remember it's also Christmas for all the people working there, but I understand that they're working as hard as they can to do as much testing as quickly as we possibly can. I might let the Health Minister comment at the end.
Just to confirm, those increased restrictions are also up until 6 a.m. Tuesday, isn't it?
Correct. So the increased restrictions are, not something that we're particularly happy about doing, but it means that for hospitality venues there'll be seated service only. So what we're trying to avoid, as you know, yesterday we said no dancing, no nightclubs, closing down the big music festivals and all that sort of thing. We're also trying to avoid those crushes at the bars and those crushes in pubs that could result in spread of the virus, particularly because a lot of the people who are at the Geisha Bar or Connections or at Mess Hall or wherever else it might have been are often young people who will be going to those pubs. So what we're trying to do is avoid those sorts of close proximity activities that often result in spread of the virus. So this is unpleasant for and unfortunate for lots of hospitality venues, I know that. But it does mean that tomorrow, if you're running a restaurant or a cafe and you've got Christmas lunches booked, they can continue with seated service.
Are you standing by the decision to allow the casino to stay open as well?
Well, the casino has mask wearing requirements. They have their requirement for all their staff to be vaccinated, and they're no different really to any other venue in that they'll be required to have seated service. So if you're having a drink whilst you're there, you're required to be seated.
In regards to unvaccinated police officers in court, given that they won't be fired up until their trial, and I believe there's 40 in the same boat, do you know if they'll be on full pay while they're waiting for that?
I'll let the Commissioner answer that at the end.
You've been in charge, heading this COVID effort now for a couple of years, and how would you rate what you're seeing today? Is this our most challenging period yet? How would you rate this?
Well, this is the most likely event to have community spread of the virus in Western Australia that we're unable to crush and kill. That's a fact, because it's the Delta variant. The person in question has been at a whole bunch of venues. He's spread it to a whole bunch of other young people at those venues. It's a difficult situation. On the other hand, we now have nearly 92% double dose. Sorry, on the other hand, we now have over 91% first dose vaccination of over 12s. We have 84% double dose vaccination of over 12s, some of the highest vaccination rates in the world. So the more we get people vaccinated, and bear in mind, when I announced the transition plan a little while ago, it was on the basis we wanted to get to 90% double dose vaccination. That was the plan before we opened borders. So if we can get to that 90% double dose vaccination as soon as we possibly can, it'll help protect the people of this state. And if you're eligible for your third dose, go and get it. Go and get your third dose. As we know, the third dose, all the advice is if and when Omicron gets here, the third dose gives you far greater protection against Omicron than does 2 doses. The 2 doses, all the advice is that it gives you pretty good protection against Delta. So if this bloke is a Delta variant positive, which we think he is, the 2-dose arrangement is good. But if and when Omicron gets here, you absolutely want to have had your third dose if you're eligible.
If we're saying this is probably not a case of crush and kill, we really have begun a new era in WA of living with COVID, haven't we?
We don't know the answer to that yet. So we'll wait and see what the testing results throw up.
Is the Supreme Court, or what transpired now, I'm not across the total detail, but is that concerning for the broader mandate?
I'll let the Commissioner, matters before the court I can't really comment on, but the mandates will remain in place and we need to get people vaccinated. But I would have thought, watching New South Wales and Victoria, and the death rates in Victoria in particular, watching what's happening around the world with lots of people dying, nearly 1 million people in America dying from COVID, understanding that we now have a person who came in who has created some community spread, that people should go and get vaccinated. You'll save your life. Basically, if the death rates around the world are the unvaxxed. So when the virus gets here, and it may well be here already, the people that will die will be unvaccinated people overwhelmingly. So if people don't learn that lesson, if they don't watch what's happening around the world, well then there's not much can be done for them. And that's why we're putting in place mandates to at least ensure that vulnerable people who are in hospitals or in disability centres or in aged care centres are protected as best we can. That critical industries are protected as best we can. That's what the mandates are about. They're actually about protecting the community. I understand some people push back on it, all that sort of thing. This isn't about individual rights. This is about everybody. This is about protecting and helping everybody and saving industries and lives more broadly across the community. And those who are out there, protesting and taking matters to the courts and all that sort of thing are fundamentally selfish people. They're all about them. They're not about the broader community. They need to have a good hard look in the mirror about their behaviour. But if and when COVID gets here, some of those people at those rallies will die. And so I can't help that if they're not going to abide by the rules and listen to all the advice.
Premier, are you worried that people might not be coming forward to get tested so that they can spend Christmas with family? And we've also seen that some people have decided not to check in just in case they get pinned to isolate. What would be your message?
We're doing our best to protect everyone, and if you do that, you're a very selfish person. So let's imagine you're at the mess hall, you've acquired COVID, you then go and have, you don't go and get tested, and you go and have Christmas lunch with your elderly grandparents, you're putting their lives in danger.
Just on the cases again, when can we expect exposure sites from those other positive
As soon as we can. We get the information, contact traces. We have, I think the Minister might have outlined it, a huge number of contact traces working now. So as soon as we get all that information, we make it public.
Of the 5 cases, you said that 3 were at the hostel. Is that correct? Of the 5 new cases, 3 had been at the hostel. Is that correct?
So of the 5 new cases, what we know, 1, I'm not sure where the person was because it only just came to light. 3 were at the Fremantle Hostel. Sorry, I'll let the health minister answer in a moment.
I assume that everyone who's got the virus is in what kind of quarantine are they in?
They'll be going into hotel quarantine.
All of them into hotel quarantine.
Or some form of hotel quarantine. Yeah.
Will there be any compensation for businesses, particularly those who have saved up, all the time, all the budgets for this festive season? I know some people have lost all their jobs overnight because of the announcement. Will there be any specific compensation?
Look, in relation to nightclubs, they have been required to close essentially for 4 days. And bear in mind, Christmas Day they wouldn't open anyway. So that's what's occurred. In relation to some of the music festivals, I expect that will have been difficult for the organisers of those festivals and probably quite costly. We'll have a look at that as to whether or not there's any sort of compensation arrangements around it. Bear in mind, I think it's can be administratively difficult to do that, but we'll have a look at that. And what I normally find is whatever we do, people say it wasn't enough in any event, but we'll examine that issue.
What about party buses as well?
Look, I'm not going to every permutation.
The Perth Mess Hall event, could that be classified as a super spreader event?
I don't know the answer to that question. We do know that 5 people came out of it. Some of the super spreader events over East I've seen, I think there's been hundreds of cases come out of them. So I suppose definitions of the doctors.
Can we get that? Health Minister?
Health Minister.
Can we, sorry to clarify on that specific. I just want to just get it clear. So we started with 1, we have an additional 5, that makes it 6. So of the additional 5, they were all at the Mess Hall event.
Yeah, that's my
right.
understanding.
So out of those 5, how many were then staying at the hostel, the Fremantle?
The information that we have is one of those were at the Fremantle Hostel. The reason that the Fremantle Hostel is of interest is because 100 of the people staying there attended the Mess Hall event. So the other positive cases are staying in other residences,
Okay, yeah.
2 in other backpackers in Northbridge, but they were the only attendees of that Mess Hall event. So the contact tracers are working through those other sites, but they wouldn't be necessarily considered close contacts. So that Fremantle backpacker, it's not just about the one person who's positive, it's the large volume of people who actually attended
the 2 other, there's 2, so at the 5 we had 1 at the Fremantle, what's it called, the Fremantle old fire station?
I think it's the old fire station.
Yeah. So we got 1 staying there and 2 others at separate backpackers, is that right?
Correct.
Are they being shut down?
No, they're not. We're working with the contact tracers are working with those residents and working through, and they'll all have to get tested, but they'll have the same arrangements as other close and
So they're in
casual
Northbridge, those
contacts.
2, aren't
They are, yes.
Can you, so,
Can you
and
tell
the other
us?
2, so that's 2, 1 at Fremantle and the other 2 were?
So 1 in Fremantle, 2 in Northbridge,
Yep.
1 just lives in the community, and the most recent case we don't have that information yet.
Can you tell us the name of those hostels?
No, I don't have that in front of me.
Do you
And
have the
the
ages of
Premier,
the people?
said they all would be going, have they already gone to hotel quarantine, the people that are infected?
So the people who have tested positive are in appropriate quarantine accommodation. We're working.
Hotel?
Yes,
Yep.
we're working with those other potential close contacts, particularly the Fremantle Hostel, and we'll be finding them appropriate hotel accommodation as well.
Do you know
Oh,
the ages of the people who are infected?
I don't have specific ages, but they're in their early 20s.
And what's the average? You were going through some of the time frames for testing. Do you have an average time? Are we seeing it within hours or days?
It is the test results are coming back within hours. We have increased our testing capacity, so most results are coming back between 24 and 48 hours. We've had some results back sooner than that, 14 hours, for example. The testers are acutely aware that people want to spend Christmas with their family. We saw 10,000 people come forward and do the right thing yesterday. I'm confident that most people are not avoiding their obligation, that they don't want to bring COVID for Christmas. They want to get tested and be cleared. So the high testing numbers are a really positive sign that we can try and get in front of this.
Are there any
Ron,
changes
just
to the
bring it on.
hospital arrangements in terms of bracing for any kind of hospitalisations?
Oh, there are surge plans already in place for hospitals if ever required, but the public health measures that we're putting in place at the moment will, and the very high levels of vaccination that we have, will negate the need for those plans, certainly in the immediate future. The current cohort that we're looking at with infections is also very young. And if this is potentially the Delta strain, evidence is that the disease is less severe in those young people.
Minister, of those, how the Freo hostel's been shut down, did you say that everyone in that hostel will be relocated to a hotel, or only the ones that were at the Mess Hall event? Everyone in the hostel?
Certainly the 100 close contacts that went to the event will be relocated.
Yeah.
I think given that the remaining residents in that hostel could be considered potential close contacts now. That's definitely a possibility that they will end up in hotel accommodation and quarantining for 14 days.
What is the definition of close contact?
I don't have the other residents in total, no.
Is there a definition of what's a close contact, what's a casual contact?
There are definitions and they're nationally set, and those close contacts are people known to them and people who've interacted with them. So have a conversation, a hug, and been in very close proximity. Casual contacts would be someone who was at the same event but didn't necessarily speak to them or meet them or have an actual interaction.
So Northbridge Mess Hall will have to quarantine for 14 days now, as that's been upgraded. Those who have received a text because they may have been an exposure site, they have to get tested and isolate until they get a negative result. Do the people who are just going because they may have been in the vicinity or maybe are experiencing mild cold and flu symptoms, do they also have to isolate until they receive a negative result?
If they have been in the vicinity and consider themselves a casual contact, they do need to isolate until they get a negative result.
So now we've upgraded the mess hall event to a casual contact, close contact. Yeah. Why aren't we doing that with Geisha Bar and Connections, which are also really tight spaces? Lots of people?
We're still waiting to. There haven't been any positive results out of those events. It may be that he wasn't actually infectious when he was at those events, and that it occurred. The infectious period occurred later. But we may get some of those results, and in that case, the status will shift. So it's a moving feast. Information comes through hour by hour, and the status of various people, from casual to close contacts, changes constantly.
Minister, are you still in favour of the February 5 reopening?
We're watching very closely, and as the Premier said, we've been extremely fortunate to get this far without community spread, and we're watching very closely what's happening over East and internationally as well.
And that fire station, the fire station hostel, do you know how many people have been affected by the lockdown?
The total number of residents in the hostel? I don't. It is a large hostel, certainly more than 100, but I don't have the total number of residents of that hostel. But that
And you
can be
mentioned before
provided.
the Safe WA check-ins had gone up by 38%?
38%.
Do you have that in actual check-in figures?
I do. It's about 1.79 million check-ins.
In just the past, well, yesterday.
So, yeah, yesterday there were 1.7 million check-ins, and that is significantly up on the day before.
Could we get the deputy show? So in recent advice from Andy, he mentioned that the studies he's looking at show that Omicron is pretty much as severe as Delta, but then we've seen stuff coming out of the UK, South Africa, that suggests that it is actually a lot less severe. Where are we kind of landing on that with science?
Look, each day we get closer to an answer to that, but we still don't have all the information to hand. There is certainly different studies show different results, but on balance, the indications are that it's less severe. It's less severe, but more transmissible.
What's your reading on the way the community spread's happened in Perth over the past 24 hours?
Well, look, it's to be expected, to be frank. We know from past experience that the places that this chap went to when he was infectious do lead to secondary cases more often than, say, a restaurant or a different type of venue. And the reason for that is that nightclubs and busy bars are often noisy, so people have to get up close to each other and talk, and the chance of transmission by droplets is increased in that way. And also, when you go out to a nightclub, not that I've been to many for a long time, but when you do go out to a nightclub, you tend to talk to a lot of people. So it's about the chance of infections happening. A lot of people, noise, and also alcohol. Alcohol is disinhibiting, as we know, and that plays a part. So because of the venue types that the exposures occurred, we did think this was a high chance of having secondary cases, and that's been borne out.
And do you expect more cases? Do you do any predictions on how far this could go?
Well, certainly we do expect some more cases, so we only have less than half the results of the people so far who have been classified as close and casual contacts back yet. So if we've already had 5 cases out of half, and the figures is roughly half, we expect more cases, yep. And then there'll be a potential for secondary cases, or tertiary cases as we call them, yep, tertiary cases. So the cases from those secondary cases have got exposure sites, and other people may have been infected by them.
So it's trying to mobilise our contact tracing forces to their maximal ability so we can just get ahead of the curve, and to try to get people who are infected and who are infectious to be isolated from others as soon as possible. That's the key to it. And also quarantining people who haven't demonstrated any symptoms yet, but we know they've been exposed as close contacts, to keep them away from others just in case they do develop symptoms.
So for the people that live with someone who might be considered a casual contact, are they just urged to isolate as best they can in that time?
Well, not for casual contacts, but certainly for close contacts. That's the ruling.
And just finally, sorry for me, the contact tracer numbers, sorry, how many contact tracers are going to be increased?
The contact tracing numbers are changing all the time. So now the contact tracing numbers that of close contacts that the Premier mentioned earlier on were excluding those close contacts from the mess hall. So adding those together, the close contacts now number 455. We've had 271 negative tests so far from that group, and 5 positive cases. Yes, 5 positive cases, because they're all close contacts, because they're all from the mess hall. And the casual contacts, we have 584 that have been identified, and 236 of those so far are negative, and we've had no positive cases from the casual contacts so far.
Is it anything to do with their age, and given that they haven't needed hospitalisation? Can you read anything into the age of these people and their infection?
Well, as the Minister mentioned, the younger you are, the less chance you are of being sick. And we know that there's very high vaccination rates at the moment, even amongst young people. So that's a protective thing. And as the Premier mentioned, it doesn't necessarily stop you getting infected. It lessens the risk of you becoming infected, but it certainly markedly decreases your chance of getting serious infections. So we know that most people are vaccinated now, so that's another reason. It's a different environment now to what we were dealing with when we had cases in the community in the past.
You know off the top of your head the vaccination rates for 20 to 30-year-olds? I'm assuming that's who you're expecting would mostly to have attended these venues?
Well, the vaccination rates for the 20 and 30-year-olds are lower than the vaccination rates for older people. It's goes upwards with age. It's still high, and because we have 91% plus first dose vaccinations in Western Australia, so just at that number you know that there's a very high level there. I don't have the precise numbers in front of me for those groups, but they're lower than the older age groups, but certainly very high. And of course a lot of those people will be affected by the vaccination mandate, so they will need to get vaccinated.
Final question, please.
Can we ask the vaccination mandate question? Commissioner, I just wanted to ask you about the unvaccinated police officers. Will they be on full pay while they're not at work?
I'm advised that the decision of the Supreme Court today was by one police officer. There's in the order of about 30 police personnel, about 23 sworn constables, and some other auxiliary officers and police staff. This injunction application was in respect of one officer alone, and the court, on the advice, I haven't read the decision because I've been here, but the advice I've got from the State Solicitor is that the court has held it only applies to that single officer, does not apply to all the others. So I intend getting further advice this afternoon in terms of further proceedings from here.
The judge said in court that the employer direction isn't a lawful one. Do you have concerns that this will trigger some more challenges from other workforces?
Well, as I said, I haven't read the advice and I've got to take some more, but I will make the decisions as in accordance with the law. So we'll review that particular matter, but I'm strongly advised that it only applies to a single officer and has no application to any other officers. So I'll take the advice.
You'd expect the remaining officers who are unvaccinated to then be out of a job?
Look, I won't preempt. It's probably not proper that I speculate on further. I'll take the legal advice and I'll do whatever is lawful.
Thank you.
Thank you.